everybody. Welcome back to the Outcomes Rocket. Super excited to be recording an episode here at HIMSS 2024. I have the amazing Dr. Geeta Nayar, also known as Dr. G. Welcome to the podcast.
Thank you for having me. Good to see you in real life.
Yeah, good to see you too. It's been an excellent conference, and you're hosting it.
It has been, I'm tired. I'm not going to lie. I'm not going to tired. It's a big place, but it's been phenomenal. It's such a great show, such great programming, amazing keynotes. It's been fantastic.
Yeah, and we were recording here yesterday and got to see you right behind us doing a book signing.
It was very neat. You didn't get a book. You didn't come by.
No, I was here. I was recording episodes.
I know people. I'll get you one. I'll get you a book.
You happen to know Dr. G? Well, let's just kick this off with kind of getting to know you a little bit better. So where did Dr. G come from?
You're so fun. I can't believe this is what you're asking me, but I have had patients call me Dr. G since I was a resident, so since I was a doctor in training. But the funniest thing is to hear my daughter kind of comment on it. She always says, "Mommy, Dr. G makes you sound a lot cooler than you actually are." And I'm like, thank you, Sonia. Thank you very much for your observation. So it's got, as I've gotten older, it's got more of a thug feel to it.
Yeah.
But at the time, it didn't seem that way.
That is so funny. Hey, we gotta love our kids, right? They always humble us in their best way. Excited to really, chatting with you as the Chief Medical Officer at RadiantGraph. Help us understand what RadiantGraph does and how they add value to the ecosystem.
Sure. Well, first of all, I'm super jazzed to be joining the team. It's a rock star team, and Mo Madan is our CEO. And really, RadiantGraph is a healthcare-based AI platform geared for payers, geared for health services organizations that are really focused on consumer engagement, meeting clinical needs, and really making sure that patients are getting personalized care. And I think that's really at the center of everything we're trying to do here, is that we have to personalize care, we have to reach the consumer where they're at, and we ultimately want to drive outcomes. And that's exactly what the patient wants, that's exactly what the system wants. It's a win-win. Love it.
Well, definitely excited to unpack the work there more. For everybody listening and watching, you'll have links to RadiantGraph and the awesome platform that they have. So let's talk about HIMSS. There's been a lot of discussions around technology, AI, and security. What's been a topic that's raised up to the top that is interesting to you, and why did you decide to come this year?
Well, first of all, I came this year because they invited me as MC, and I have been a HIMSS member for over 20-some years. I was on the board. I have been involved in HIMSS from the beginning, and I think it's phenomenal what they're doing with the show, with the new relationship with Informa. So I'm thrilled to be here, thrilled to be the inaugural MC. Hopefully you guys think so as well. But I think for me, the biggest theme that has happened, and I've seen it progress in the industry, is we have a lot of technology. We have amazing technologies, innovations, AI is the beginning. We saw some drones flying around earlier. But the last mile of healthcare remains the human factor. It remains meeting the patient where they're at. If you develop an innovation in the lab, in a pilot, but you can't actually scale it, you can't actually get it to where people are and to the people who most need it, well, that's a failure, and I think everyone continues to struggle with that. We see pockets of success, pockets of innovation, but the real meat is getting it to be across the ecosystem and easy and inexpensive.
That's a really great insight, Dr. G, and just helping be more consumer focused is a target for a lot of organizations. And for those that couldn't be here to benefit from the sessions, what advice would you give them to help get there?
Well, I think first and foremost, the closer you are to clinical care delivery. So what does that mean? It means understanding the front end of care, even if you're operating in the back end, right? So even if you're helping with prior auth, even if you're focused on value-based care contracting perhaps, really you have to understand how patients receive, engage with healthcare, and also what they expect. So that's really important. And one way to do that is through clinical leadership, having a chief medical officer, having a chief nursing officer, making sure that you're really listening to those that are closest to healthcare delivery, even if you yourself as a leader are not. And at the center of all of it is listening to patients. We all talk about the consumer. We all talk about wanting to meet the consumer, but really understanding what that means and where they fall down on the patient journey. Doesn't matter if it's the provider side, payer side, that's really the key.
Love it. Great tip, and a great way for all of us to think about it. Now, to close things out on this Insight series, I want to just ask, what call to action would you leave our listeners and viewers with? And where's the best place they can reach out to you and learn more about the work you guys are doing?
Sure. So, as far as my call to action, I would say, again, we're living in the most historic time in healthcare and health tech. We have AI, we have telemedicine, all of these things have become a reality and no longer a science fiction movie. But keeping the human at the center, keeping the consumer at the center, understanding their personal care needs, their journey, that's really the power of where tech comes in, and being able to truly personalize care, do real consumer engagement. That is really where also the ROI is at, right? So it's not just the right thing to do, but there are any number of revenues to be made on the provider side, the payer side, you name it. As far as where to find me, I'm now a member of the RadiantGraph team. Our website's a great place. My website's a great place, but I think I might be one of the easier people to find out there in the social media space as well.
Love it. Well, you do such a great job, and we appreciate you jumping on the podcast today and spending time with us. Thanks, Dr. G.
You bet. Thanks for having me.
Yep. And everybody, thank you for tuning in. Check out the show notes for ways to get in touch. Take care.